Harold never missed a checkup. Every year, right on schedule, he went through every recommended screening. It gave him a sense of control, like he was one step ahead of whatever might come. But one routine test led to another, and another, until Harold found himself preparing for a procedure he didn't fully understand, to treat a suspicious finding he never even felt. What if some of the medical checkups we trust the most are the very ones that send us down a dangerous path? If you're in your 50s, 60s, or beyond, you've probably been told to keep up with routine screenings to stay healthy. But here's something most people don't realize. After a certain age, some of these tests can do more harm than good. Over the next 20 minutes, we're going to explore 5 common medical checkups that millions of older adults undergo every year, often without question, and why blindly following them may not be the safest path. We'll also talk about smarter, safer alternatives that put the power back in your hands. Because protecting your health isn't about doing more, it's about doing what truly matters. Harold's story isn't unique. In fact, it's part of a much bigger pattern, one that quietly affects millions of older adults across the country. Over the last 2 decades, the number of medical tests and screenings performed on people over 65 has skyrocketed. Full-body scans, yearly MRIs, cardiac stress tests, colonoscopies, bone density scans. They've all become routine, almost unquestioned. For many, these tests provide peace of mind, a feeling that more testing means more protection. But here's the truth. Beyond a certain age, more testing doesn't always mean better health. In fact, it can sometimes lead to unnecessary anxiety, invasive procedures, and even serious complications. This phenomenon even has a name in medicine: overdiagnosis. It happens when tests find things that look concerning but would never actually cause harm in a person's lifetime. A harmless spot becomes a possible tumor. A minor age-related change becomes early signs of disease. And suddenly, what began as a routine check turns into a cascade of follow-ups, treatments, and side effects. This cycle doesn't just cost money, it costs peace of mind, and sometimes it costs health itself. The goal of medical testing is to help us live longer, healthier lives, not to turn every wrinkle, spot, or natural change into a medical emergency. But when the system treats aging itself like a disease, we have to start asking harder questions. Coming up, we'll break down 5 of the most common screenings that may do more harm than good after a certain age, and what smarter, safer alternatives you can consider instead. Number 1. Bone density scan. Grace always believed in staying ahead of health problems, so when her doctor suggested a bone density scan, just to be safe, she didn't hesitate. Bone density scans, also known as DEXA scans, are designed to detect osteoporosis early, and for some people, especially postmenopausal women at higher risk, they can be useful. But here's the catch. After age 70, mild bone loss is common and not always dangerous. Yet the scan often leads to a diagnosis of osteopenia, a gray zone between normal and osteoporosis that can trigger years of unnecessary medication. Many of these drugs come with serious risks: esophageal irritation, jaw problems, even rare fractures. Research shows that bisphosphonate drugs reduce fracture risk by less than 0.3% over 5 years in people with mild bone loss. Meanwhile, regular strength training, vitamin D, and calcium-rich foods can make a far bigger difference. For most healthy adults over 70, simple lifestyle habits are safer and more effective than rushing into medication after a routine DEXA scan. Number 2. Brain MRI for mild memory lapses. Occasional forgetfulness happens to everyone, but for Charles, a few misplaced keys and names led to something much bigger: an MRI referral. Brain MRIs can be life-saving when symptoms are severe: sudden confusion, vision changes, or new neurological deficits. But for typical age-related memory changes, they often raise more questions than answers. Up to 86% of older adults have age-related brain changes visible on MRI, but only a tiny fraction, about 3%, are clinically meaningful.
Unfortunately, these incidental findings can lead to anxiety, unnecessary follow-up tests, or even risky procedures. For mild memory issues, simple cognitive screening tests, better sleep, and daily brain exercises are often far more useful than jumping straight to an MRI. Number 3. Cardiac stress test in people without symptoms. Feeling winded can be normal, but for Evelyn, that single moment led to a treadmill stress test, a test often ordered just to be cautious. Here's the issue. In older adults without clear heart symptoms, stress tests can produce false positives up to 40% of the time. That abnormal result can set off a chain reaction, invasive procedures like angiograms and stent placements that may not actually improve survival in people without symptoms. Large clinical trials have shown that in many older adults with stable heart disease, stents don't prevent heart attacks or extend life compared to lifestyle changes and medications. If you don't have typical symptoms like chest pain or shortness of breath, a simple ECG or a coronary calcium scan may provide enough information without the risks. Number 4. Colonoscopy after age 75. Colonoscopies can save lives when used wisely, especially between ages 50 and 75. But beyond 75, the picture changes. The procedure is tougher on older bodies. Risks like bleeding, perforation, and complications from anesthesia increase significantly with age. In fact, studies show that for adults over 75, colonoscopies cause 10 serious complications for every 2 lives saved. For most older adults, simple annual stool tests, FIT, can detect colon cancer just as effectively without the hospital visit or sedation risks. Number 5. Full-body CT scans for peace of mind. It sounds appealing, scan your whole body and catch everything early. But in reality, full-body CT scans expose you to massive doses of radiation, equal to hundreds of chest X-rays. Most of what they find are tiny harmless anomalies that would never cause problems, but once they're found, the pressure to do something kicks in, leading to unnecessary biopsies, surgeries, and emotional distress. Experts estimate that up to 5% of cancers in the US may be linked to medical imaging radiation exposure. That's similar to the cancer risk from alcohol. Instead of scanning the whole body without cause, targeted imaging guided by real symptoms is safer and far more meaningful. Each of these 5 tests can be life-saving in the right context, but when used routinely without clear need, they can set off chains of worry, procedures, and complications that do more harm than good. The key isn't to avoid medicine, it's to use it wisely, understanding when a test truly helps and when it may not.
Here's the truth. Staying healthy after 70 isn't about chasing every possible test. It's about making every choice count, including the choice not to test when it's not needed. Step 1. Listen to your body, not the noise. No one knows your body better than you do. Subtle changes in energy, appetite, sleep, or mobility often give you more valuable information than a random scan. If you feel well, don't let fear push you into unnecessary procedures. And if you notice something new, that's when targeted, focused testing makes sense. Step 2. Ask the right questions. Before agreeing to any test, pause and ask, what are we looking for? What happens if we find something? How will this change my care? Are there safer alternatives? These questions transform you from a passive patient into an informed decision maker. Doctors respect patients who think this way. It leads to better conversations and better outcomes. Step 3. Focus on what truly matters. Decades of research keep pointing to the same simple truth. The real power of prevention lies not in machines, but in daily habits. Staying active, even gentle exercise like walking or resistance bands, strengthens both body and brain. Eating nutrient-rich, real foods keeps inflammation low and energy high. Prioritizing deep sleep, connection, and purpose adds years and quality to life. These are the habits that protect against disease far better than over-testing ever could. Modern medicine is a powerful tool, but it works best when we use it wisely.
If you or someone you love is over 70, share this video with them. Start a conversation about which tests truly help and which might not. In the comments below, tell us, have you ever gone through a medical test that turned out to be unnecessary? How did it affect you or your loved ones? We read every comment, and your story might help someone else make a smarter choice. And if you found this video valuable, don't forget to like, subscribe, and turn on the bell icon, because in the weeks ahead, we'll explore the simple, science-backed habits that make aging stronger, clearer, and healthier than ever.